and I'm a registered nurse here at the LaJolla Institute. I'd like to show you how to prepare and use the large volume blood bag. I'd like you to also please reference tare and target weights for blood volumes and preparation of heparin additive and large volume blood bag procedures, which I have sent you previously. First, what we're going to do is we're going to open up our 3 ml syringe with needle, and we're going to take our heparin sodium, 10,000 USP in 1 ml, and our 20 ml of normal saline. We're going to open everything up. I'm going to wipe them clean just for good measure. And we're going to draw up all the contents in the 1 ml bottle. Withdraw all of the heparin. I'm going to put all of this heparin, 1 ml, into the bottle of normal saline. So now we have a heparin mixture. In this case, you're shooting for 250 mils inside the bag. What I've done is I've made a chart, and I have multiplied 250 mils times the specific gravity of whole blood, which is 1.058. Weight in grams is going to be 265 grams. The tare weight of this bag is 36 grams. We're just going to add 10 mils, and we're just going to call it 1-to-1 in weight. So I'm going to take this needle off, and I'm going to put this onto my 10 ml syringe. We're going to add 10 mils of air to the heparin solution. And we're going to draw 10 mils. This is now going to be 5,000 USP in 10 mils. We're going to add it. We're going to take off the little blue piece here. And we're going to add it straight to the bag. Make sure you hold this up, or else it will not go down into the bag. It will spill all over the table. So go ahead and do that. You're going to put all that in there, and then you're going to clamp it just like that. Okay. For the sake of asepsis, just kind of hold on to that so it doesn't touch anything else. We're going to pull off the end cap for the apheresis needle, and we're going to put it on aseptically, just like that. Okay. Now you're ready to go. Now you have your needle, you have your bag. You want to determine the weight that you're going to get first. Before you insert the needle into the donor's arm, please look at your chart. For this particular procedure for 250 mils, 311 grams is what everything should weigh once you take the needle off, the procedure is done. In order to get there, we're going to shoot for 10 below the target. So we're going to shoot for 301 on the scale. What you're going to do now is you're going to get your digital scale, make sure that it is in grams. You're going to hit it, zero it out, and then you're going to put the bag down. Do not zero it out after the bag is drawn on there, or else you will overdraw the donor. At that point, you can go ahead and you can start your donor. Once you hit 301, you're going to just tape this down. If I can find the end of the tape. Well, anyway, you're going to tape this down, and as soon as it hits 301, you're going to clamp that just below the connector, and then you're going to pull this up. You're going to put your 2 fingers there on the gauze, and you're going to pull that right through. It'll just pull right out of the donor's arm, and this should be engaged. You should hear a click. At that point, remove the clamp, let all the blood flow out of the tubing, and re-clamp just below the connector. At this point, you can take off the apheresis needle, and you can put that in sharps. You're going to put on the end cap, and now you can release the clamp. All the blood should be down in the tubing. You may now tie a knot at the very bottom close to the bag as possible.